All right, welcome back. I am here with Town Supervisor Peter Van Scoyoc in town of East Hampton. Welcome, Peter.
Thanks, Michael. It's great to be back on the show this week.
Our weekly Friday guest here, and we appreciate that. Thank you for coming. I know there's probably a lot to talk about, but I know one of the things that's really big on people's minds right now is the fact that now we kind of had an uptick in the hospitalizations for the last couple of days, but now we've come back down on 2 days in a row, and it gets kind of confusing. I know there's 7 measures, right, that we need to measure before we'd be even cleared or be even considered for reopening businesses. And where are those numbers, Peter? Like, in other words, now that we had the downturn again, do we have to go back to the beginning, or how does that work?
No, that's based on a 3-day rolling average. So one of the very first criteria is that you have to have a 14-day consecutive decline in hospitalizations. And we were at day 13 in Suffolk County when suddenly we had a 2-day consecutive uptick. Now we've gone back the other direction. So hopefully that was just an anomaly and we'll continue on this trend. But currently we do actually meet that criteria, I believe. There also has to be, fewer than, let's see, hospitalizations have to be down to under 2 per 100,000 of residents with a 3-day rolling average. So, we're at 5.79. We're in the red zone on that. We're in the red zone still on the number of deaths in the county. And we're actually being considered Long Island region. So our numbers are going to be considered along with Nassau County. You have to reach a threshold of 30% of the total number of hospital beds being available. And that's once resumption of elective surgery has begun. Right now, elective surgeries are not being performed to improve hospital capacity. The share of ICU beds also has to be 30%. We're at 26 on ICU beds, so we're getting very close to meeting that threshold. We're at 28% on the total hospital beds, so we're very close there. Then we have the testing. So we need 30 per 1,000 residents tested monthly. The 7-day average of new tests per day. We're meeting that now, and I'm very pleased to announce today that I've arranged for local testing right here in East Hampton.
Oh, wow.
It's going to be next door at Pantago Place. I've been working with HRH, Hudson River Healthcare, and we've put them together with the East Hampton Healthcare Foundation, and they're going to be using town property where the Pantago ball fields are, that parking lot. We expect that to go online on May 15th. That's next Friday.
Wow.
The testing will occur on Wednesdays and Fridays. And we're extremely excited about this. Initially there weren't enough tests to have more than one testing site in all of Suffolk County when this first rolled out, and that was Stony Brook University. There were so few tests that they only had the one site. And as testing has ramped up, they've increased the number of sites based on the availability of the actual tests. So now we're at a point where we can have this here in East Hampton. I'm very excited about it because it means that we'll be able to serve our residents here locally to have a better understanding of how widespread the disease is. And we'll be able to tell folks, that they have it and they should be quarantining. And then another part of this is going to be contact tracing. One of the criteria is that you have to have at least 30 contact tracers per 100,000 residents. So we're not quite there yet for Long Island at 852 contact tracers. And with my press release coming out later today about testing, we'll have a link to the Suffolk County's application form for anyone who wishes to seek employment as a contact tracer. This will be a very important job because we want to try to figure out who infected people may have come in contact with to make them aware that this has occurred and that they should be taking precautions to prevent the spread of the disease. So as you said, there's 7 different criteria in those metrics. That's kind of a high hurdle for us at this point, but we're making steady progress towards that. I don't know to what extent the governor will lift restrictions here on May 15th. I just want to caution everybody that we may not be quite there, but we are headed in that direction. And hopefully, if not on May 15th, shortly after, we'll meet those criteria. That will mean that some businesses will be able to get back to work. Among the top priorities, the governor has listed manufacturing and construction, those industries which will be at lower risk and have highest economic importance and essential nature about them. There's a number of different phases of rollout of various businesses depending on how well they would be able to proceed with business and protect the public. The higher risk type of businesses will be in the later phases of reopening. Those might include restaurants, and certainly movie theaters and other large gathering places would be in the 4th phase.
That's great. And then the so we're part of the Long Island region. So in other words, we can't say it came to the point where town of East Hampton, town of Southampton met that criteria. They couldn't open up without the rest of the other townships opening, correct?
At this point, that is the case. Like I said, we're being considered Long Island as a region in terms of meeting the metrics. We certainly could make an argument that Eastern Long Island is obviously very different than Nassau County, and that perhaps we shouldn't be lumped in terms of meeting those metrics. At the same time, you have to understand that our neighbors in Western Suffolk and Nassau are very much part of Long Island and are very likely to be, traveling here at some point during the upcoming summer season. So I think, that's considering the entire region, because we are all so closely connected. Obviously, our supplies come from points west as well. Those folks that are making deliveries and whatnot. So I think the regional approach is important. Some of the upstate, more remote rural areas will be opening up, I think, by May 15th and things resuming there. Again, I think we can get to where we need to go in terms of the metrics if everybody is really just diligent about wearing their face coverings when they can't social distance and in public, and really trying to stop the spread of this disease. I think if we keep working on that, we'll get to the metrics and get back to some sense of normalcy as soon as possible.
Yeah, and the governor also announced that the evictions are going to be pushed back now, or the not being able to evict someone is being pushed back till August, which is fair. And so I know that a subject that's near and dear to my heart, as you know, Peter, actually I'm asking for someone else, is property tax. And I know that they're due at the second payment is due at the end of May. Is there any consideration being given to that? Have you heard anything on that front?
So there's been a lot of consideration given to that, and the town supervisors have brought that up numerous times. Suffolk County has the ability to waive the penalties and interest for those who find themselves in a COVID-related hardship where they couldn't pay. And we've suggested that be extended to like August without penalties and interest for those who have a proven hardship related to COVID. Obviously, if you've lost your job and you were counting on, those paychecks to be able to pay your taxes, you're in a situation where you can't make that bill on time. If you can possibly pay that bill on time, please do. We don't know at this point whether there will be a waiver of penalty and interest. And frankly, I think in the 32 years of home ownership, I missed my tax payment once by 1 day, thinking I could pay it late in town hall, and you can't pay it in town hall. You have to go to the county center to pay it. It's turned over to the county for collections at that point, and I do not recommend that if you can avoid it.
Okay, that's good to know.
So we've asked for relief for property taxpayers. It's a very complicated issue in that if we don't get the collections on time, that means that villages and school districts in particular, and the county itself, will not have the funding that they need. And we want to avoid, the impacts of that, because if there's budgetary constraints, that means that, people may be laid off. This is a cascading impact. You mentioned the governor extending to August 20th, that there are no evictions before that. We need to continue to do whatever we can to buffer ourselves from having a cascading economic impact. And so that means that we need additional support from the federal government in particular. I expect that there's going to be a phase 4 funding plan. It's being discussed right now in Congress. So hopefully, the money will go where it needs to go. We're working at every level that we can to, assist our local businesses. We have a business reopening committee, as you may know. I may have spoken before about it on this program. We are currently meeting with business leaders within the town to specifically talk about each of the major industries in town, how a safe reopening might occur and when, what protocols need to be in place to ensure the public that we're not going to have a resurgence and continue to spread this contagion while being able to get people back to work, because that's important as well.
Sure. And with the unemployment numbers coming out today, which were, amazingly high, and so is there any way to break that down to like the town of East Hampton, or I mean, obviously it's going to be 1 in 5 anyway, probably. But
yeah, that's a good question. And currently, as I said, we're considered to be part of the Long Island region, but we have, looked at those 4 phases of reopening that the governor's talked about. And one of the requirements will be that any of those businesses, as they reopen, have to have plans in place and safety protocols. And it varies from industry to industry. Obviously, some industries will put people in closer contact with each other than others. That will require additional sanitation and disinfection. That will require, some creative thinking, the use of protective personal equipment, masks and gloves and that sort of thing. But for instance, within the hospitality industry, discussions have taken place about having remote check-in and check-out so that you're not bringing people into, the front desk area, for instance. They could go immediately to their rooms, having keyless entry, that sort of thing, along with just how you route people through public spaces or communal spaces, what kind of amenities would or would not be offered. All of that has to be considered by each individual business and have a plan in place to deal with it. The town itself has been working on that for a number of weeks now. How do we reopen to the public and invite the public in a way that's safe for both our employees and the general public? We are in the process of installing plexiglass screens at countertops within offices, separating desks and whatnot, so that when we get the signal that we can go ahead and move forward, that we're all set to do so.
Well, that's great. But I mean, you have a lot on your plate, and again, as I told you last week, we really appreciate all that you and the board are doing and fighting the good fight for us. And we look forward to hearing some more good news. So thank you again for joining us this week. And we'll see you if we don't hear from you before next Friday. But thanks for giving us the scoop on the new testing facilities that will be here in East Hampton. And we look forward to that. And thank you very much. Have yourself a good weekend.
Thanks, Michael. I'd like to just give a quick shout out to all the volunteers and all the frontline workers again. All you're doing for our community to pull us through this time. And I want to suggest that those who wish to help with the testing effort can make their donations payable to the East Hampton Healthcare Foundation, who is graciously acting as an intermediary here to help us get local testing. And I'm very pleased that we're moving forward with that. So again, thanks to everyone for doing your part. Stay safe, be well.